Hello everybody again, this is Dr. Barry Georgium from Lifestyle Chiropractic in Green Lake, mylifestylechiropractic.com. So today we're going to continue on with our video series on sciatica, and today we're going to do and demonstrate a treatment protocol for someone with sciatica. We have already done our assessment and examination of the patient. We've taken x-rays, we've done the functional assessment and workup, and we've established that there is indeed sciatica running down the left side of her leg, and we're going to proceed with treatment. So we've established on the patient here where in the lower back there indeed was a restriction and fixation. As I mentioned, joints that don't move properly. This puts stress on the sciatic nerve itself, but it also causes the muscles around the area to tighten up. So we want to start on a table like this, which is a traction table or a flexion traction table that is actually going to do some of the stretching for us. We don't always want to have the patient do the stretching, as it can irritate that sciatic nerve. So we want something like this table that can do the work for us. We want to keep in mind as well, as the sciatic nerve travels down the back of the leg, it's going to pass through in the buttock area a really tight, strong muscle called the piriformis. This piriformis can really be a contributing factor to sciatic pain, and we want to make sure that we're doing what we can to relax that muscle to give the best chance of taking stress off of the sciatic nerve as much as possible. So we're going to get the table going, and what this is doing is just providing a gentle, passive stretch to the muscles of the lower back and then down through to the leg. So we can also stabilize the spine and give an additional stretch to the lower leg. If this is uncomfortable, we back away from that. But what this does is it really calms things down in the back muscles, and it gives a better opportunity to restore proper movement and remove stress to the lower joints of the spine. Now, when we actually do an adjustment to the joints of the lower spine, we want to consider that our lower back has a curve in it. We know that as the small of the back, correct? It's an inward curve of the lower back. What we want to do is open that up to give a better chance of moving or opening those joints. And that's what this position allows us to do. Locating which area in the spine the tension is, and then giving a gentle adjustment to open that area up. That takes pressure off of the nerve root that forms part of that sciatic nerve, and it also offloads compression on the disc between those joints. We're going to go next in our series of videos here in terms of what else can we do to help rehabilitate things and help prevent this from happening over and over again. I want to invite you to follow us on mylifestylechiropractic.com, follow our YouTube videos where we have videos on sciatica, as well as a whole host of other videos there for you to learn and enjoy. Thanks a lot.